Hello, my name is Bashua Edwards, and I would like to share with you the condition of dilated cardiomyopathy. Dilated cardiomyopathy refers to the presence of left ventricle dilation associated with non-adaptive pulsations, without unusual load on circumstances, and acute coronary artery disease. During this condition, the heart muscle becomes weakened and enlarged, and as a result, the rest of the body gets an insufficient amount of blood. This condition is serious. More people, especially males, should be aware and educated of this condition. Today, I will share with you my findings on cardiomyopathy. I am sharing today genetic factors, abnormalities in the immune system, exposure of toxins in the heart tissue, and metabolic, energetic, and contrail abnormalities. Research today into the pathogens of dilated cardiomyopathy has brought out four major causes: genetic factors, abnormalities in the immune system, exposure of toxins in heart tissue, metabolic, energetic, and contrail abnormalities. Here is a picture of a normal heart, and on the other side is right ventricle hypertrophy, which is also known as dilated cardiomyopathy. Here are some of the genetic factors. According to MedPub, Central PMC Elizabeth McNally and Lewis in 2018, the major causes of family DNC is malfunctioning genes. A family setup where the first or second degree family members can meet the criteria of DCM diagnosis, and one of the relatives are affected. These are available findings to prove that family cardiomyopathy can be considered to be directly linked to genetics. Genetic DMC. The genes most commonly involved in dilated cardiomyopathy and their reported causes are listed here. Here I also shared a radiograph of the heart, right and left ventricle. Also, here are some of the abnormalities. Metabolic, energetic, and contrail abnormalities are indicators of the progress of the disease. The tangle of the beta receptor cord, decreased metabolism of the high energy phosphate has been observed. IDC victims appear to have activation and a greater decrease in receptacles than in heart disease. Also, immune abnormalities. Virus infections, abnormal developments in the immune and genetic system are some of the factors causing dilated cardiomyopathy. According to Rose-Wispsky criteria, 50% of biopsy samples used in evidence containing cardiac immune cells infiltrates family HLA class II expressions used as markers to signal autoimmune disease on the cardiovascular walls without evidence of the ventricle genomes from the available samples. Several autoantibodies in DCM patients' cardiac muscles have heavy chain D myosins, and cardiac alpha informs begin the common autoantigen interaction with virus may result in T cell activations. This interaction results in the systematic of activated cytotic T cells that can deform and destroy cardiomyocytes. However, here are a few exposures from toxins. This is a heart that has been diagnosed with Dilated cardiomyopathy. I'm sorry. This is an unhealthy heart. You can see the damages here. According to nature.com, Andrew, Catherine, and Naveed in 2019, abuse of alcohol and prime genes of DCM often transpire middle-aged men, person who have been consuming large amounts of alcohol for at least 10 years. Dysfunctioning of the heart muscle associated with excess alcohol intake is also alcoholic cardiomyopathy, ACM, which leads to heart failure. For ACM diagnosis, alcohol consumption is usually over 80 grams per day for at least 5 years. A study concentrated on the alcohol intake amount that could DMC among working age men from Japan. Cardiomyopathy was discovered in 2 of the 6 men, 33%, whose alcohol intake exceeded 150 milliliters daily. The scientists found that an increase in the ventricle thickness when alcohol suppressed 60 grams per day and was higher than those consumed with over 100 grams a day. However, now that I've shared with you my findings on dilated cardiomyopathy, I would like to leave you with this factor. Not only does dilated cardiomyopathy lowers the quality of life, but its diagnosis and treatment are also equal to costly and require constant medical attention. This condition can also lead to death if not acted upon promptly. Thank you for listening.